When we look at obesity, we're really talking about a chronic disease, and the focus of obesity management is not so much on weight loss, but is really on health gain. And we are very excited about the fact that we've been able to put together a set of measures that draw our focus away from the numbers on the scale towards actual measures that are important to people living with obesity. And when I talk about these measures, we are talking about things that go way beyond height and weight. We're talking about measures that actually reflect the health and well-being of people living with obesity. What makes this set of outcome measures special is the fact that this was put together by a panel of experts, but also people living with obesity. In fact, we had 29 people we had 29 people with expertise in obesity, either because of their experience as clinicians or because of their lived experience from over 20 countries. Who got together to define exactly what it is that we should be looking at when people undergo treatment for obesity. Again, the focus not being on what happens to the numbers on the scale, but really what happens to health and well-being and all of the other parameters that really matter to patients. By now having this defined set of parameters that are important to patients and will give us a much better understanding of how patients are responding to obesity treatments, we hope that this standardized set of parameters is going to make it much easier for clinicians to monitor whether or not the goals of obesity management, which is improving health and well-being in people living with obesity, is actually being achieved in their clinical practice. What makes the set so special is the fact that there were actual people who have lived experience with obesity very much involved in coming up with this panel of measures. And so we expect that this panel of measures will actually reflect the improvement in health that people can experience when they undergo effective treatment for obesity. Well, the big challenge now, of course, is to implement this set of measures in clinical practice. Now, the measures, there's a total of 20 measures. These include patient-reported outcome measures. These are clinical measures, but they're also important case mix measures so that we can really define the population that these measures are being applied to. The challenge here, of course, is getting our clinical colleagues to implement these measures in their clinical practice and use these measures to guide their treatment of obesity. We hope that this set of parameters is going to help clinicians refocus their attention away from simply looking at numbers on the scale to looking at measures that actually matter to patients. Well, the best way to get involved in the implementation of these measures is to join the ICHOM Learning Collaborative on Obesity Management. And this is going to give you an opportunity to not only review all of these parameters, but also is going to assist you in implementing these parameters in your clinical practice.